Good morning, everybody. My name is June O'Sullivan, and I'm the Chief Executive of the London Early Years Foundation. We have a habit of doing interesting webinars, and today is another one of those because today we're going to look at everything to do with teeth. And you may wonder why this is an important thing, but teeth and small children are a magical combination. And when we get it right, then they can smile. But when they don't, they suffer a great deal. And the main reason children under 5 go into hospital is because of tooth decay. And the statistics on tooth decay are really quite scary. And so today we have my own dentist, in fact, Dr. Kushel Morjaria from Crystal Palace, is going to actually give us his time and knowledge about how it's so important that we get the whole understanding of oral health right from the beginning. That is also going to be combined from September when the Department for Education intends to introduce a formal supervised toothbrushing service in all nurseries. That will be mostly for children aged 3, although in many nurseries, like at Leaf, we already do it with the younger children. So I'm going to hand over to Kushal, who's going to take us through a most interesting presentation, and we will be able to share that widely, and you indeed can share it widely on all the various social media methods that are available to us. So thank you very much, Kushal, for giving up your time. I know you're very busy, and we're all very looking forward to what you have to say to us this morning.
Well, thank you for having me on board, and I feel very privileged to be able to have this opportunity. I know this is going out to lots and lots of young families, and I think it's like you said, talked about regarding the smile. I think it's a very powerful statement you made that it also adds confidence to the child and improves their well-being. And I think there are multiple benefits to the awareness being there so that we can maintain good oral health. Thankfully, the last 30 years have seen a massive change in the understanding of the importance of the oral health of the child. And I'm very pleased that from September, as you said, the Department of Health has created an initiative which will significantly not just help improve the awareness of the importance of brushing, but also empower the young children going forward and give them the confidence and the knowledge to actually do things properly. Because as we all know, when they're young, they like to be independent. So it's really nice they've done that. And I think it's something I'm very pleased about. I'll begin with the slideshow itself. And we are working in association with the nursery group. We're the Mindful Dentist in Crystal Palace, and we are keen to support this initiative that June and her team have put forward, because I think it's, as I said, very important for not just the well-being of the children, but also their confidence. If they have a healthy teeth and a healthy smile, it does add value to their lives. So I've had obviously the welcome from June, and they have had extremely good feedback from Ofsted, and we feel very lucky that we can support such a wonderful organisation, and we look forward to continuing to do that in the future. Just to start the presentation, and just to really educate the parents, because obviously the parents will be receiving the slides, and it's helpful for the kids to see some of these slides as well. So I would actually suggest, if possible, when you sit down and have a look at these slides, if there's anything there that you feel will help you communicate with your child, even this simple diagram of teeth with arrows on it, any visual aids are very useful. Explaining something to a child, as we all know, is one thing, but also if they have a visual aid, like a picture, it does carry weight, as I found with my own daughter when she was in this age group. So there are 3 main types of teeth. They're here, obviously here marked A, B, and C. Obviously, we all know predominantly what they're used for. And in the animal kingdom, we know about, obviously, carnivores, and the word canine is connected to that. Obviously, the incisors help you bite and chew. and the molars are important to crush and grind your food. Just to say, interestingly, this distribution of teeth categories exists in both the initial set of teeth, or what we call baby teeth in layman's terms. In dentistry, we call them deciduous teeth. But the same categories also apply in adult teeth. So it translates across. Obviously, the number of teeth increases once they are adults. And we've also within that you have premolars and lateral incisors, but that just they're in between the incisors and canines. And then obviously the wisdom teeth, which are something that come along a lot later, not necessarily in this age group, but sometimes I get questions in the surgery from parents about crowding, which I'll touch on later, and also wisdom teeth, even though obviously they don't arise till the late teenage years. But interestingly enough, you can see them forming on an X-ray a lot earlier than you'd expect. So that's good to know for parents, but it doesn't have any significant impact on their on their management. And obviously they're the last teeth to come through. The main concern at this age group for 0 to 5 is the maintenance of the baby teeth. But as I said, we do see them on scans quite a lot earlier on than you'd expect. So when we start with what we'll start with first, and we'll go into when the baby teeth come through. And the reason it's important that I share this information with all the parents is that I sometimes in the surgery get children coming in, parents bringing their children in, and they're concerned because the child is having gum issues or gum tenderness. Rest assured, a lot of that time it's related to just a new tooth coming through. In the 0 to 5 age range, you tend to only have baby teeth present. Adult teeth don't start to come through until 6 or 7, and we'll go into more detail about that later. So when the baby teeth do come through, you'll find, which will be shown in the next couple of slides, the 0 to 3 age range is when the baby teeth come through. Usually the first baby tooth comes through at about 6 months and thereabouts. Obviously, we're not all photocopies of each other. There's usually some variation on that. And then it continues till about 2.5, where the last baby teeth to come through. So this question is, obviously there are 20 baby teeth in total, usually by the age of 3. And they remain as it stands until usually 5 or 6 before the adult teeth come through. Here you can see a summary of what I've just said. The words shed, erupt and shed are just referring to eruption simply means when the baby teeth come through. Shed means obviously when they've been when the baby teeth are replaced by adult teeth. And as I said, to not overcomplicate things and simplify things, your key markers are, just to summarize this table, at 6 months, just to repeat that again, at 6 months, the first baby tooth comes through, and or there or thereabouts, until about 3 years, when the 2.5 to 3 years, when the last baby tooth comes through. And then everything's quiet usually. Between 3 and 5 years of age, the teeth are static, as I said. And just as they cross into the age range outside of the remit of what we're talking about today, as in we're obviously focusing on 0 to 5, just for parents who have children at the 5-year age group, you do sometimes, but rarely, but you do sometimes with 5-year-olds or 5.5, even just around that marker, they might complain of pain at the back. And again, it's been quiet since the age of 3, and then all of a sudden they're complaining of pain at the back. And that's because usually their first adult molars are coming through. And that, again, is summarized in this slide as well. And then obviously just a bit of information for the parents, because obviously you're all adults. And it's nice to include that as well. Adults tend to have between 28 and 32 teeth, depending on whether they have wisdom teeth or not. This obviously looks at why you may or may not need a brace. Interestingly, the reason I put this slide up, and obviously I discussed it with the nurseries prior to setting the presentation up, I found that sometimes parents bring their children in and they're concerned, obviously, that the teeth are not straight, the baby teeth. And just to reassure you on that, that sometimes when we have teeth that look crooked at this stage, at 0 to 5, we don't really intervene that much, unless obviously we're concerned. Usually what happens is we allow the time to elapse till about 11 or 12, because that's when they would need a brace if they need one. And we don't move baby teeth, just so you know. It's important that I don't want parents to worry too much if there's a little bit of misalignment. Obviously, it's my duty of care to tell you that you should obviously get an opinion from a dentist, because cases can vary case by case. So I totally understand that, the importance of that. And but also just to reassure a lot of parents that braces aren't used until all the adult teeth are through, usually around the 11 to 12-year marker. And by then all the baby teeth have been lost. So they can then put the brace on adult teeth as opposed to moving any baby teeth. So we tend to leave the baby teeth alone. And also at 0 to 5, naturally, compliance is not as good as it would be in the older years. So it would make sense to wait anyway, but obviously you need to bond to adult teeth. So that's the main reason we wait till about 12 once they're all through. And this is just a picture of an older child than the group we're covering today, just so it can see the massive difference. And I would say that once your child is a bit older, do consider looking into that if you feel it can be useful, because it doesn't just make the teeth look nice. It's also important because it makes cleaning the teeth a lot easier, because you get less areas of plaque and bacterial buildup, which reduces decay risk long term. So it's something to bear in mind. And I'm sure some of the 0 to 5s have older siblings who are entering this category already. So there is some value in mentioning it on this presentation today. We've also, in conjunction with the nurseries, we've managed to find a couple of videos that have some useful information. The first one has appeared now on the slideshow, and it's about how to brush your teeth. And I think this is super important, because I think that if you can include the children in the process, it empowers them, and they have a feeling that they're actually a sense of independence, and it then fosters a sense of them wanting to do it even more. So I would definitely, this video is actually aimed at this age group, so please do watch it and with your kids if you can, and they can actually then get a real handle on brushing properly. I will say, just before you watch the video, that the key factors are: number one, most people only brush what they can see. That includes adults and children. When I say that, I mean the lip line often covers the gum area, and the teeth themselves are the bits they see when they smile. And they will brush the top parts of the teeth up here, but they won't often go under the lip line to where the gum sits, because there's still tooth up there till it meets the gum junction. So when you're brushing, but also when you're brushing your child's teeth, please remember to get a little bit higher up to the bits you can't see. So remember that mantra. There's a lot of people, both children and adults, that only brush what they can see as opposed to what they can't see. And just move the soft tissues around, so you can, when you're helping your child brush, please get into those areas that are covered by the facial profile. I understand at the sort of 0 to 3 mark, especially, that might be tricky. As you evolve to 3 to 5 years of age, that compliance level improves. That was the first point about this video to take on board before you watch it. And the second and final point is each tooth has 3 surfaces: outside, top, and inside. Again, most people will brush what they can see, which is usually the outside surface. And that's fine to not do as much on the edges of these incisors, because they're thin edges. But remember, children also have baby molar teeth. So those teeth at the back have a wide platform surface, and those platform surfaces have grooves in them. Now, those grooves are harbor for bacteria, and can result in decay formation. So it's important that we get the toothbrush on the back biting surfaces as well. Going back to what I said earlier, 0 to 3, I understand there will be a compliance issue with that. As you go further back, I find that there's more resistance in the younger age categories. But as you cross over from 3 to 5, we find compliance rapidly improves and they allow you to do a lot more. And also, if they feel they can do one round of brushing themselves and or they see a sibling, that is amplified. As a parent, I think it's important to know this because we know as dentists that from your premolars forward, teeth are often cleaned really, really well. The majority of decay I find when a child is dropped back in the chair is on the biting surfaces of the back teeth, because obviously it's further back, number one. The other area where I find decay most often is on the sides of the back teeth. The reason being the soft tissue, the cheeks, they tend to squeeze up against the sides of the back teeth. Now, with an adult patient, I can say to an adult patient, just half close your jaw. That will give you more give in the cheek and you can slide back. With a child, you're trying to help them brush and they won't necessarily want to close half closed to get more give to allow you to slide in on the side. So what I would suggest is you explain it to the child, you run the video, and also show them when you brush, why you brush, where you brush. Now that I've educated the parent, maybe pass on that information to the child. My key thing is prevention is better than cure. That's a phrase we all know. And sometimes using the fluoride toothpaste, providing a low sugar diet, which everybody knows about in 2025, just knowing where to go and the places where we find when we drop the patient back, there's more decay, that's also a key help for long-term survival of teeth. And once we get into good habits early, that helps to preserve the teeth for a lot longer. And we mustn't undervalue the power of baby teeth. People often say to me, I've had parents say to me, oh, a second set of teeth is coming through, it's fine anyway. To be honest, if you ask an orthodontist, they'll say to you, well, actually, if I take the baby tooth out early, it's going to close the space and not allow the adult tooth to come through. So a 0 to 5-year-old, to preserve the teeth you have is critical, not just from a cosmetic perspective, not just from a confidence perspective, but also from a maintaining a space for the adult tooth to come through. If that tooth is lost early, unfortunately, it creates a difficulty for the adult tooth to come out. And then that makes the orthodontist's life, when that child is then 12, 6 or 7 years later, much more challenging and will complicate the brace treatment. So there's, multiple layers as to why it's good to maintain everything from an early age. So I'm really glad that we're able to do this presentation to all of you.
Yay! Time to brush! Why do we brush? We brush to remove plaque and stay clean.
What's plaque?
Plaque is yucky stuff that can stick to teeth. Plaque is bad because it's full of nasty germs. These germs can hurt teeth by making little holes called cavities.
No!
Plaque and cavities make teeth weaker. That's why it's super important to brush all the plaque off every day. To keep healthy teeth, we have to brush for 2 minutes every morning and 2 minutes every night before bed. It's really important to brush your teeth the right way. First, make sure to use a special kid's toothbrush when you brush. Kids' brushes fit little mouths and have soft bristles. Put a little dot, about the size of a pea, of fluoride toothpaste on your brush. Parents have to help babies brush their teeth. And babies can't use fluoride toothpaste. You have to be able to spit to use fluoride. Once you have the toothpaste on your toothbrush, open your mouth wide. Start with the teeth in the back of your mouth and brush in little circles. Work your way to the teeth in the front of your mouth. And don't forget to brush the gums. Move the brush back and forth, gently in short strokes. Brush the top, front, and back sides of each tooth. Make sure you get the insides of all the teeth. When you're done, be sure to spit out all the toothpaste. Don't swallow the toothpaste. It will upset your tummy. When you're done brushing, it's time to floss. Flossing can help remove food and plaque from in between teeth and along the gum line. Parents should start flossing their children's teeth as soon as they have 2 teeth that touch, and they should floss twice a week. When you floss, break off about 18 inches of floss. Wind the floss around your pointer finger. Hold the floss tightly between your thumbs and your fingers. Guide the floss between your teeth using a gentle rubbing motion. Never snap the floss into your gums. When the floss reaches the gum line, curve it into a C shape against one tooth. Hold the floss tightly against the tooth. Gently rub the side of the tooth, moving the floss away from the gum with an upward motion. By the time you're 7 or so, you should be flossing every night at bedtime with your mom or dad's supervision. One other way we can keep our teeth clean and healthy is by eating and drinking healthy foods. Eating healthy foods for breakfast, lunch, and dinner is the best way to keep your teeth and whole body in good shape. If you're hungry and want a snack, try foods like fruit, raw veggies, and low-fat cheese. Stay away from sugary sodas and sweets. If you're thirsty, drink water or low-fat milk. If you brush, floss.
This is obviously for the parents, but also it's nice for the kids to have some information. I would say most importantly is that there's 2 elements to this I want everyone to take home. The first element is enamel, is the top layer of tooth. Enamel provides the strength, is the strongest element to the tooth structure. It's even stronger than a lot of filling materials we use. So you can see avoiding fillings and avoiding decay is better long term because whatever nature's given you is far better. Also, the other thing I would say is, and I want some of the parents to just take this on board, is point 3 on this slide, which is some people are born with slightly weaker teeth. There are a few conditions that come up on teeth that you see in young children, and then that triggers us to do a referral to a specialist, child specialist dentist to have a look further into this. Some of these conditions are related to what we call hyperplasia, and the teeth are slightly weaker. That's the main take home from that. And often we know, and you would know, that there's something going on because the teeth, rather than look a whitish color, they'd have a yellow hue to them. And those teeth tend to be a bit more susceptible to decay. And so that's why I think it's early to get in on the dental checkups when you can. If you look at some of the literature and the NHS guidance, the advice, and even when I was trained at dental school, the advice is to start the checkups when the first tooth comes through. But I would say at 6 to 9 months, compliance is a challenge. So do your best with that. Even for us as dentists, compliance is a challenge for 6 to 9 months, for a 6 to 9 month year old to allow us to have a look. But it's worth trying if you can. And that's the recommendation currently anyway. Sugar. I would say with sugar, obviously, again, in 2025, I feel parents are extremely well informed compared to maybe 30, 40 years ago. I think that's helped in 2 ways. That's probably helped with decay levels, but also I feel that makes our lives as dentists easier because children are often a bit more confident in the dental chair. I would say, obviously, this guidance is relating to sugar cubes and sugar. I would minimize the sugar as much as you can. It's fine to have numbers up, but if I'm honest, bacteria can't form or struggles to form without some sugar in the mix. So if we can minimize it as much as possible, and I know as a father myself, that's a struggle. Kids go to birthday parties and so on as they start to leave the 3 to 4 year age range and start to go into the 5-year age range. Sometimes you can't always micromanage everything they eat, and I understand that. The nurseries are getting really good at being aware of this and trying to substitute things for carrot sticks, cucumber sticks. These are all amazing things to do. And I would also be mindful of hidden sugars. So I have very conscientious parents in Crystal Palace that come to me, very conscientious, very caring, very loving. and they get upset when their child has decay in their mouth, and I can see it visually on their face. I can see it in their body language. And to be honest, that comes down to sometimes hidden sugars. They're great parents. There's nothing wrong with them. They're brushing well. They're giving them a healthy diet. But sometimes some of these sugars, some of these products we buy, especially in processed food that we think are healthy, does have sugar in it. So please do look on the ingredients label, at the sugar label. And it's not just for teeth. I mean, we know now that sugar impacts us in many ways, not just negatively on teeth. And there's not to say that we shouldn't have sugar at all. Fruit has sugar in it, but it's fantastic. It's another form, has a slightly different. It does obviously can affect the teeth and can cause decay. But it is actually obviously better than refined sugar, and I would say that that's quite a nice thing for us to focus on if they want a treat. And as I said in the last point, it's found in fresh fruit and milk. But again, this chemical structure of that versus refined sugar is slightly less harmful. I would say dried fruit, just as a side point, some kids like some raisins and so on. That does obviously have slightly more sugar in it because it's dehydrated, so it's more the sugar content's more concentrated. That's just something to be mindful of. And if you're going to give a snack to a child, we look at the impact that sugar has on the pH level in the mouth. You want to try and minimize sugar in between meals. I know a lot of you know this already. And try and have it immediately after a meal so that the pH in the mouth can restore itself midway through the morning or the afternoon, which then helps to help teeth stay healthy and reduce decay risk. So that's a very nice point to end the slide on. I think it's useful to understand the process of tooth decay and how it develops. I think there is two components to that. I would say, obviously, three actually. I would say sugar content, number one. Two, if the teeth are slightly weaker. Three, genetic susceptibility. So if the one factor we definitely obviously have control over is what's going in, and the children aren't buying the goods, we're buying the goods, we're buying the items. So it's up to us as responsible parents to take charge of that. I request obviously you watch the video. It's tailored for obviously a younger audience, which is the whole idea of this presentation. What I've done is I've basically tried to speak to the parents on a informative level for an adult, but at the same time, the two videos provided in today's presentation include things that children can watch, and they are ultimately, it's their teeth, it's their mouth, and they should be part of the process and feel they're empowered. When we give them knowledge and we do it with love and kindness, they're going to take that on board and run with it. If we try and obviously force it to them or explain it in a less than helpful way, we won't get the same response. So I think, yeah, please enjoy these two videos with your children. It does show, this second one does show how decay forms and how then we fill the tooth, but it does it in a very gentle way. A lot of kids come in and they're sometimes very nervous of having any treatment, but something like this really helps to make them understand why they're having it done. I think 30, 40 years ago, children were just told this is what's happening. They weren't explained anything as much as they do now, not in every case. But I think the nice thing about things now is that we are trained as dentists to explain things not just to the parent, but to be inclusive to the child, which makes the process much smoother for them. And yeah, enjoy the video. I certainly did. So yeah, enjoy it.
Hello, friends. Today we'll learn about tooth decay. You're brushing your teeth. That's great. You should brush your teeth twice a day with fluoride toothpaste for 2 minutes each time. Remember, your friend had severe toothache yesterday. It might be due to tooth decay. Tooth decay, or dental caries, start as plaque, which is the sticky film that builds up on your teeth. The bacteria found in plaque produces acid that destroys the surface of your teeth. The acid can eventually cause your tooth to decay, which can also lead to it creating a hole in your enamel, and this is how you get a cavity. Here are some common signs of cavities. Bad breath or a bad taste in the mouth. Bleeding gums or facial swelling. Redness around or inside the mouth. Continuous toothache or mouth pain. Tooth sensitivity to hot, cold, sweet, or sour food or drinks. You're having Coke with your friend. Sugar-sweetened beverages have high levels of sugar, and drinking these can significantly contribute to tooth decay. Some common reasons include having unhealthy food items like chocolate, sticky candies, sweets, crackers, potato chips, and other acidic things. A poor oral hygiene routine, such as failing to brush or floss daily. Not getting enough fluoride. A persistently dry mouth. Twice-a-year dental checkups are the best way to catch cavities early. You may also get dental x-rays. It can help your dentist detect cavities and gum disease before they worsen. Now, let's see how cavities are treated. Cavity treatments include fluoride. When decay is caught early, fluoride treatment can repair tooth enamel. This process is known as remineralization. Fillings. Once a hole forms in the tooth, dentist drills out the decayed material and fill the hole. Dental fillings are made of silver amalgam, gold, or composite.
Things that can cause sensitivity. Sometimes when you have a 0 to 5-year-old, we're relying on their perception of pain and their ability to discern what tooth it is, what they're feeling. I would just reassure the parents that especially at the younger half of the 0 to 5 age range, sometimes their ability to locate what the issue is and where it is vastly different to someone, say, who's 5 compared to someone who's, say, 2.5 or 3, as we know. And again, vastly different to someone who's an adult. So before panic stations kick in, and I've been, as I said, I'm a dad myself, so I completely empathize with all parents out there. Make the appointment, go and see your local dentist if you have any concerns. And sometimes it's something very simple. As I said earlier, at this age group, some baby teeth are coming through, and towards the end of this age group at 5, usually at 6 though, but in some kids during their 5th year, but rarely, their back first adult molars come through. Sometimes it's just something really simple. And once the children feel that they're confident in the chair, they'll open up. And also I will say that if you've got one child who's over 5 and they're confident in the dental chair, maybe bring the under 5-year-old with you to that appointment. Say if you can book it in a half term or Easter holidays or summer holidays, so that you can have both kids there, and the younger one can just watch the sibling have a checkup and see that there's nothing to be nervous about. Just to refer to this slide, sometimes it's just something simple. Obviously, hot, cold, and sour things can cause pain, but often it can be when the decay is, if a decay is present, or as this slide shows, there's worn out enamel or a lost filling. So if the tooth's worn, in layman's terms, basically to the parents, this is if the tooth's worn or a filling's been lost, that can be a simple reason as to why there is pain, or it can even be some, like it says in the second 2 highlights, fracture of the tooth or tooth decay. But all of these things can be solved very easily. I will say as well, if they did come in for treatment, we do have a whole section now in dental school, UK trained dentists, on something called pediatric dentistry, which is children's dentistry, and we are taught how to approach children differently in terms of tell, show, do. And, before we dive in, we often explain things, number 1. 2, that there's often some sort of video these days. If not, sometimes we just visually show things so that they, we'll call the suction tube a vacuum cleaner, or something they can relate to on at a home level. And I think that's useful in alleviating concerns and making the child more confident in the dental chair. I hope that slide was useful for everyone. Sometimes I have had parents bring a child in and say they're getting bad breath. Can be dietary related. Sometimes, yes, it can be. On point 2, we talk there about hygiene and not brushing regularly. I wouldn't say that exists as much now, but I would say that that could be of 2 reasons. Number 1, maybe they're not getting as far back as they could. So parents, please help them get to the back, because those areas are still storing bacteria. It could be that the smell's there. Secondly, if the back adult molars are coming through and they're just in that latter age category of the 0 to 5 group, that you can sometimes get a bit of gum that sits over the tooth, and you can get bacteria in there, and that can create the bad breath. And I certainly hope they're not smoking at that age, but yeah, that's on the slide anyway. And then so this is just a bit of fun for you to think about afterwards. And I would say, obviously, I just wanted to touch on the 4th point there in the slide, which I haven't mentioned so far, but it is mentioned earlier. Just try and do the 2 minutes if you can. Please bear in mind that please be patient with kids, especially the ones that are under 3. I have had parents come in, they're very frustrated because they can't get all the teeth cleaned. Just to reassure you, it's very common that happens. The more we try and push, the more they resist sometimes. The key is to stay calm and to stop that day if it's not working. I've had parents say, look, what else can I do? And I've actually, with my own daughter, for a while, she wasn't accepting a brush. So I would wash my hands thoroughly and put a little pea-sized amount of toothpaste on my finger, and then just try and get a little bit on the back teeth. But ultimately, brushing is very powerful and important. But obviously, one of the most important things alongside that is the sugar, as we've mentioned. So even if you're not getting exactly where you want to get, especially in the younger age group because of compliance, just remember that bacteria can't create decay without the sugar substrate there. So if your brushing is not where you want it to be for your child, just remember that. And some tips and tricks when you are brushing, which has been mentioned in some of the literature that the nurseries have sent out to all of you. Nice to get, if you can, to get your younger one, the 0 to 5-year-old, maybe if they've got an older sibling, to watch them brush their teeth. Again, touching on what I said earlier, at the checkup in the surgery, maybe just get them to observe their older sibling in the summer holidays or Easter holidays having a checkup at the same time, because obviously the person they look up to, their older sibling, they're going to try and emulate that. That's their role model. So I think that's powerful. And just to reassure you all out there, you're all doing an amazing job. Just remember that it's a process, and allow the child to slowly feel empowered and be able to brush their own teeth, and do it in a systematic way. You've got 2 options. One is obviously brushing with them, and then 2 is to kind of allow them to take over and have one sitting themselves out of the 2 times they brush, and the other time you do it with them, which is what I did for my daughter. So it worked very well. She doesn't have any fillings anymore. She doesn't have any fillings, sorry. So we did something right, which is good. And I'm glad that you've given me an opportunity to speak to you today, and to go through the slideshow. And I hope it's made a difference. I think, as I said near the beginning, prevention is better than cure. And it's important that we try and follow the guidance, but at the same time, every child is unique and every child will respond differently. Some children will gravitate to what you show them and say very quickly. Others may need a bit of gentle persuasion, even within siblings. And that's okay. There's no right or wrong. So I see parents sometimes get very stressed about this topic. And just to reassure you, it's very common. And with time, most kids, if not all kids, do come good. And these days, obviously, the knowledge is out there and the awareness is out there. And I think generally you're all doing a lovely job. So keep it up. Thank you for listening. I hope you've enjoyed the presentation. And I want to thank the nursery group for allowing me to come on board and speak to all you wonderful people. And yeah, just a hello and a thank you from the Mindful Dentist family at Crystal Palace. And thank you again for listening. Thank you, June.
Thank you, Kushel. I was very interested in that. You think you know stuff and then you hear it again and actually you realize maybe you don't know as much as you know. And it's very reassuring to hear that pediatric dentistry is kind of coming to the fore. And I love your style, and I think it's very reassuring for parents and for children that it's like, do what you can, take your time, be patient, it'll be okay. The other thing that was really fascinating, I think, also is hidden sugars. And at Leaf, we set up the first early years chef academy precisely for that, because of the big concerns about the increase in child obesity and also oral health decline, really. And it's been fascinating for us to really unpack the nutritional needs of small children, but to understand how much hidden sugar and salt is actually in processed foods for children, often badged as healthy options, are good for your child. We've kind of put it into the sort of greenwashing box. So parents really shouldn't give themselves a hard time on that. It's so cleverly done. It's so easy to get sucked into that. You really think you're doing your best, and then you find out later on that actually you've been sort of fooled by the marketing messaging. So thank you again for that. We have put together a little information pack which will be downloadable. So we hope you will to use those. This is for anyone really working in nurseries, working as childminders, parents themselves, grandparents, anybody at all who might find this useful, then use it accordingly. It's not often you get the opportunity to really just spend a little bit of time looking at the art, craft and science of toothbrushing. So thanks very much again, Kushel, and I promise not to ask you to do too much extra the next time I go and have my teeth checked.
If I can help in any way, I'm not just obviously talking about you, but just generally with the nurseries, it's a pleasure. So thank you for having me today.
Not at all.